I want to welcome folks to an interview series that we're going to be doing in conjunction with the Maine Town Meeting, which will be held on June 1st this year from 11 a.m. to 1 p.m. And our focus is going to be on the Margaret Chase Smith Policy Center. The library is actually administered by the University of Maine, and we're under the direction of the Policy Center. So for the past 10 years, we've become quite involved with one another. And we wanted to highlight that the work that they do there in terms of policy. They touch on a lot of different areas, and we're going to interview staff members, and they're going to talk about the areas that they're involved with. And today we're going to be speaking with Dan Soucier. Welcome, Dan.
Hey, thanks for having me, David.
That's our pleasure. Thank you for consenting to do this. So how long have you been with the Policy Center?
So I started with the Policy Center in spring of 2019. So I guess it's 3 years have flown by quite quickly.
Very good. And what is your role at the Policy Center?
So I work on the Rural Drug and Alcohol Research team. Right now, I'm a research associate, and I involved with several projects. The one I'm involved with the most is I'm the project lead for the Maine Drug Data Hub, which is sort of a repository for state reports, data metrics, dashboards, maps, and all things kind of substance use disorder related for the state of Maine.
Okay. And other projects that you're working on as well?
So I also work with the Options Initiative, which is the, let's see if I can remember what the acronym is.
Acronyms, we like acronyms.
Yeah, it's the Options Program Options Initiative is the overdose prevention through intense outreach, naloxone, and safety. And so I do some data support for that program, some programmatic direction, and some basic analysis work and things like that. We also launched a sister site to the Maine Drug Data Hub called getmainenaloxone.org. And that site is, the goal of it is to link folks with the crucial medication naloxone, which is used to reverse opioid overdoses. So it links folks to public health agencies where they are able to obtain the medication to have it on hand or to redistribute as community organizations.
Okay, so hopefully we'll now have some time to go a little more in depth with each of those programs. First of all, where can people find this information? People who are listening to this interview, if they want to go and get to any of these sites, what's the best way to do it?
Sure. So the Maine Drug Data Hub is at mainedrugdata.org, .org, and Get Maine Naloxone is getmainenaloxone.org. The other thing is I've developed, talking to stakeholders, I've developed a listserv. So every week, 10 days or so, I send out a blast email address or email that has all of the metrics that have been updated on those websites over that past period of time. And that can be reached at updates@mainedrugdata.org.
Okay, so there's lots of information out there for people who might be interested in this topic. You just mentioned stakeholders. Who are some of the stakeholders that you work with?
So we work with the Office of Behavioral Health. We work with the Governor's Office of Policy, Innovation, and Future. We have standing weekly meetings with both of those. We also are involved in a variety of state meetings, and we provide some administrative support, some other people on the team. We're involved with the Opioid Data Sharing Committee, Overdose Data Action Committee, the Naloxone Steering Committee. And so these are, it's kind of a unique mix of public health and public safety folks. So you'll have law enforcement entities, Maine EMS, municipal public health agencies, and other people that work for various offices in the state of Maine.
And you just mentioned other team members. What aspects of the work are other team members doing? Some of whom will probably be interviewing as part of this series. What are some of the other aspects of this rural drug and alcohol research project?
So we provide a lot of research and evaluation for a variety of state programs. We provide meeting administration support. So we run Zoom meetings, create meeting minutes, and kind of moderate several of these state meetings. And we also have are involved with overdose surveillance work, so tracking the mortality and morbidity of overdose in the state of Maine.
Mm-hmm. Do you know how many people are part of the team?
I don't. It keeps growing and growing. So I'm not entirely sure. With the Maine Drug Data Hub, we have about 6 or 7 folks who are providing analytical support, tech support through web development, Tableau data analytic dashboards, mapping, things like that.
Now, with the Drug Data Hub, are you just providing data, or as you just mentioned, are you providing some analysis as well?
Yeah, so one of my favorite things about it, and this is probably like you, I have a PhD in history, so I like the narrative aspects, and I think one of the unique parts of the Maine Drug Data Hub, as opposed to other data dashboards that exist throughout the United States, is we try to provide some sort of analysis of the data. It's not just sort of a data dump, but we provide a little bit of narrative around these things. So certain metrics have gone up X% over the last year, and so much over the years prior, and that is kind of to help people gauge and understand the data, because data without that analysis, without that context, is just sort of can easily be misunderstood, or not everybody is there's varying levels of data literacy. I myself tend to be on the really liking the narrative stuff, as opposed to being very tech minded. So it's a nice mix of visualizations, narrative, and analysis. So yeah.
Are you the one creating the narratives?
Oftentimes, however, we are launching a new expansion to the Data Hub called Story Maps, which they use GIS, various GIS tools.
Tell people what GIS is.
So it's a geographic information system. So it uses we're combining maps with graphs, narrative, and interactivity with the goal of educating folks, of engaging folks, and of erasing stigma around substance use disorder. So right now I have three different folks are working on narrative aspects for that, and a couple more are working on the tech aspects of that. And so we're really trying to tell stories like, why is the overdose epidemic happening in the state of Maine? Or what does treatment look like in the state of Maine? What does recovery look like for folks in the state of Maine? To provide a lot of that narrative context around the various issues having to do with substance use disorder.
So I went on to the Drug Data Hub website in preparation for this interview, and there's lots of content there. And I think when I printed off, it sort of highlighted 5 different areas. And I think you might alluded to there's like 10 different things that are being tracked. Can you give people an example of just like one area that if they went to the website, they could find data?
Sure. So there's the website, like you said, is carved into 5 different focus areas, and it's based on Maine's opioid strategic action plan. And those 5 focus areas are leadership, prevention, harm reduction, treatment, and recovery. So there's metrics on all of those things. So to unpack one of them, prevention data would have stuff on metrics on law enforcement interdiction. It would have metrics on the prescription drug monitoring program, and so various aspects of state response that involves preventing substance misuse.
Mm-hmm. And I believe I read that you are updating this information very regularly. So it's even if someone looks at it one time, if they come back a week later, they're likely to find more new information.
Yeah, absolutely. So we update. That's the other unique thing about the Maine Drug Data Hub is instead of just updating metrics on a quarterly or on an annual basis, as soon as data becomes available from the various data gatekeepers we work with, we post it. So some of our metrics are updated at a monthly cadence, some of them are updated quarterly, and some of them annually. I would say about 75% of the information on the Maine Drug Data Hub gets added to on a monthly basis. So it is a ever-changing website. And like I said, every 7 to 10 days or so, I send out a blast email with what updates are out there. So it is changing almost on a daily basis, definitely on a weekly basis.
How can the public become part of those email blasts?
Yeah, so right now we have an interesting array of folks. We have people who work in treatment and recovery facilities. We have the media has signed up. We have legislative aides, and then we have sort of general interested public. And many of these folks reach out to me. There's a couple email addresses affiliated with the website that deal with either data request or support or things like that. And so, yeah, we interact with folks if you have specific questions about the hub. So yeah, it's definitely open for the public to get those updates.
Do you keep track of what the usage of the website is?
Yeah, so we do keep track of the usage since it launched. So the Data Hub is fairly new. It launched in February of 2021. Mm-hmm. And since that time, we have had 31,219 individuals who have accessed the hub. So these are deduplicated. So this is a pretty big reach for the state of Maine when you consider there's about 1.3 million people, 1.3 million people living here. So we feel like that's a pretty good success.
Mm-hmm. We started doing these interview sessions because of the pandemic and not having direct access with the public. So this is a way that we could get some content out. And so a lot of the way that we framed these interviews was how the pandemic was affecting people. Can you give some insights into how the pandemic might have been affecting drug overdose?
Yes, we've certainly seen an uptick in fatal overdose, both nationally and in the state of Maine, throughout the course of the pandemic. And of course, it's a very complicated issue, and it's hard to draw exact causation. But folks experience increased isolation during the pandemic. Obviously, it's a very stressful time, a very triggering time for folks. So specifically folks who have had problematic substance use in the past, it can trigger folks to start using again, or folks that are currently using to engage in more chaotic or risky substance use behaviors. And so that is that's some ways that the pandemic has impacted substance use disorder in the state.
Is there anything more you want to tell people about the Drug Data Hub?
Yeah, it's a fantastic resource for folks. It houses probably around 150 data reports. We release monthly fatal and non-fatal overdose reports. State reports from various agencies are housed there. So if you're interested in substance use disorder information, or if you're working in the field, if you're applying for grants, or if you're just a concerned individual who wants to kind of have more context about what's going on in the state around this issue, it's a great resource. Yeah.
So you have a bit of an archive library function to the hub site where people can find these reports.
Yeah, absolutely. So we have reports going back, and instead of replacing or just updating, a lot of websites I researched when developing the hub just sort of had, you didn't have that historical look. You didn't have that ability to see how things had changed. You just sort of had the snapshot of how things were at that month or at that quarter. And so being able to see how things have changed over time, getting that longitudinal look, we felt was important. So yeah, there is archived reports going back, some of them going back into the early 2000s. So we've gathered reports that went back in time, and so folks can access that as well.
Well, that's an advantage of having a historian run this hub site. So tell us more about the Options Initiative.
Sure. So the Options Initiative is a very unique program nationally, and it was sort of an innovative project that was launched in the fall of 2020. And what it does is it embeds a behavioral health clinician into a law enforcement agency in each of Maine's 16 counties. And the idea is, as law enforcement or EMS responds to non-fatal or fatal overdoses, these behavioral health clinicians go either as a co-response, so they go alongside of law enforcement, or they go as a post-overdose follow-up call, and they engage with folks who have had these, sort of scary experiences, and they say, well, how can I help? Can I get you engaged with harm reduction services? Can I get you engaged with a treatment provider? Can I get you engaged with recovery services? And they learn more about people, and they also do events out in communities. So they go to local community events, or sometimes they go to food pantries and things like that. They set up tables, they hand out literature, and so they do things like that. They do trainings with law enforcement. They do trainings with other clinicians in the community, and so they have the dual role of not only this co-response, but also in doing overdose education, anti-stigma education, and things like that. So they become really known commodities in their community to help be those kind of linkages to folks to different services in their community.
And what is your role in this initiative?
So we designed, we worked alongside the options liaisons to figure out what they felt was the most important aspects of their work. And we developed a reporting tool for them. So every month they have to report data based on the work they have done. And we wanted to not only have it track what is required for federal or state grant purposes for reporting, but we wanted to get a better idea of what the work was that options liaisons were doing, and also to use this data collection to identify what demographics are being served, right? What demographics, what are the gaps in demographics being served, and how maybe can we address those? Identify the strengths of the program, what the weaknesses are, what the opportunities are, what the barriers are. For folks. And we also added not only quantitative data reporting, but qualitative as well. So they're able to fill out narrative and say, as an options liaisons, here's the barriers I experienced over the course of this past month, or here's the barriers my clients experienced over the course of this month. And this is reported, I create a monthly report of this every month. and it goes to state policymakers, and they are able to use that to say, okay, well, here's some barriers folks are experiencing. How can we kind of knock those barriers down? How can we make system-wide changes to address some of these problems of getting folks linked to treatment, or getting them linked to recovery, or whatever the case may be.
How long has this program been going on?
So since the October of 2020, so about a year and a half, I guess, at this point. Yeah.
And at this point, do you see any trends emerging?
Yeah, so there is a lot of positive trends with the options program. So you can imagine, me working with the data hub, I'm touching a lot of data points from various state programs. So I have a good sense of, how various programs are performing. And it's the options initiative is really, I think, a keystone program for the state. It's doing a very good job reaching the BIPOC community, so Black, Indigenous, persons of color community. It's doing a great job linking folks experiencing unstable housing or experiencing homelessness to programs. And then, so engaging successful programs for referrals to treatment. The literature says that if you can get 60 to 65% of folks that you refer to treatment actually to attend their first appointment, that you're doing a good job. And the options program is far exceeding that. I think program wide for the full year and a half, it's sitting around about 88%. So 88% of folks they refer to treatment are going to that first appointment. So that is really highlights the efficacy of doing that kind of face-to-face post-overdose follow-up visits, where you're asking folks how you can help, and you're linking them to what care that they need.
In all the data that you have collected, is there like a rule of thumb of what percentage of the public has substance use disorder?
So prevalence is a very hard thing to put your finger on. We're trying to develop on the University of Maine team, we're trying to develop a way to better gauge that. So using things like treatment data, using the amount of enrollees in syringe access programs, using the folks who experience non-fatal overdoses through the Maine EMS data or through law enforcement data, to try to get a better sense of that. Right now, the best data we have is the national kind of self-reporting household surveys. And that puts Maine somewhere around 8% of folks who have a substance use disorder. So that could be alcohol use disorder, opioid use disorder, stimulant use disorder, or anything like that. Okay.
And then another project you had mentioned is the Get Maine Naloxone website. So can you tell us a little more about that?
Sure. So we noticed that the hub was having some great outreach, and we provide administrative support and data support for the Maine Naloxone Distribution Initiative.
That means that the University of Maine, and it actually maybe the Policy Center, they actually are in charge of distributing the naloxone out in the community.
So we don't distribute it ourselves. The state has contracted with 3 municipal public health partners. So Bangor Public Health, Maine General Medical Center, and Portland Public Health, as well as the harm reduction agency, Maine Access Point. So we do a lot of naloxone projection work to figure out how many doses are going to be needed by folks. We provide administrative support to the meetings, and we kind of work in the steering process for us. So we don't, through the Margaret Chase Smith Policy Center, we don't administer the naloxone ourselves, but we have helped set up the scaffolding of the program and things like that. And so the website is really clear. So there's several programs in addition to the Maine Naloxone Distribution Initiative that distribute naloxone in the state. So there's the Options Initiative, which I mentioned prior. There's Maine EMS is doing naloxone leave behinds. And then through law enforcement agencies, law enforcement officers are holding naloxone on their person. So if they encounter somebody who's experiencing overdose, they have that life-saving medication on them. So this website, we said, there's no real central place where folks can go to figure out, how do I obtain naloxone? How do I have it on hand in case, I encounter an emergency? Or if I'm a law enforcement officer, where do I go to get a dose of naloxone or get a kit of naloxone? So it's kind of a clearinghouse to steer folks where they need to go. And so it provides that kind of logistical support, I think. Yeah.
And to just take a little step back, can you explain to people what naloxone is?
Sure. So naloxone, there's a common trade name for it, Narcan, which folks may be more familiar with. But it basically is a medication that can reverse the respiratory suppression effects of opioids. So it can reverse what would be a potentially fatal situation and reverse that overdose and save folks' lives.
It can almost literally bring people back from the dead.
Right. Yeah, exactly.
Yeah. All right. So you work for the Margaret Chase Smith Policy Center, and you're collecting all this data on some very important public policy issues in the state of Maine. Do you think of, as you're dealing with this, of possible policy options that we have for this very severe issue that we not only have just in Maine, but all throughout the country of opioid abuse? Do you ever think of policy options?
Yeah, we absolutely do. So we use the Policy Center, I think, is really good at using research, using evidence-based research out there to help understand the critical issues that are facing the state of Maine. And so we do that on our team. And so we provide research on kind of, what evidence-based interventions are out there. How are they implemented in other states? How are they implemented in other countries? What Maine's options are for doing some of those sorts of things. So yeah, in addition to doing the program, helping to administer programs, doing the web development stuff, we also are engaged quite actively. We have weekly standing meetings with the Office of Behavioral Health, as well as the Governor's Office of Policy Innovation and Future, to discuss those exact things of how do we take this data that we have and turn it into action.
So there is a policy element to it. And as you're alluding to, it's not necessarily that something new has to be devised. It may be finding a solution that's been done in another state or another country.
Yeah, that's true. But Maine is kind of a unique animal in and of itself, as folks who live here know. A lot of people have probably heard the phrase that there's two Maines, right? So there's sort of a more urban or in southern area of the state, and then there's rural areas of the state. And each of Maine's 16 counties has their own cultural and societal norms. They have their own ideas about how society should be. And so there's a lot of, Maine is often thought of as being very homogenous, but it's actually not the case. There's a lot of cultural and social diversity throughout the state. And so when devising policy, it's important to take those differences into consideration so that you're kind of, integrating policy based on consensus and compromise rather than just kind of a broad brush solution, because what works in Portland might not work in Washington County, right? So those are important things to take into consideration.
So the last element I want to delve into, and you've alluded to it several times in your answers, is your unique background in being a historian doing these public policy issues. So can you talk about your training as a historian and how it may shape your view of some of the work that you do?
Yeah, absolutely. So the type of historian I am, I guess, is an environmental historian. So I look at the ways built environment as well as natural environment kind of impacts society. So you kind of have nature on one hand and society on the other, and there's this intertwined nature between the two of them. And so a historian is really unique, I think, in the realm of public policy. And I would encourage more historians to get engaged in public policy work because historians have a very unique toolkit, I think. So historians, you know, in your training, you learn to identify key issues. You identify who the key stakeholders are, right? You think about who has been included, who has been excluded, right? And so in policy, you can then think about, okay, well, over time, this group has been excluded from this discussion. Who should be included today, right? And then you know, as doing historical research, you have to figure out what the complex reasons are for what you're studying, right? So for policy, you can use your historical toolkit to figure out what the complex reasons are for why things are the way they are today. And then you're able to think about what are the, if policy is implemented, what are those complex consequences that could come out of that, right? And so history, you know, I think is really well suited to be able to aid public policy, specifically in the realm of understanding why things are the way they are, and then for developing consensus and compromise in policy rather than just sort of either, you know, ruling directly from above and saying this is how policy is going to be, or you know, you're able to really identify who those stakeholders are and come up with solutions that are going to work for everybody.
Well, Dan, I want to thank you for your time and for explaining the different aspects of the Rural Drug and Alcohol Research Program at the Margaret Chase Smith Policy Center, and encourage people to go and look at some of those websites that you mentioned. When we post this interview on Facebook, I'll make sure to add those websites in so that people can maybe just click right on them and go right to them and find some of the data that you've been collecting. And just remind people that we're doing this in conjunction with our Maine town meeting, which will be on June 1st, where we'll look at the work of the Policy Center, and the director of the center, Jonathan Rubin, Dr. Jonathan Rubin, will be our featured speaker. But we're going to have all these other interviews that we're dropping leading up to June 1st so that people have a more expansive view of all the work that the Policy Center does in relation to pressing issues in the state of Maine. So again, I thank you once again for being with us today. Bye-bye.
Thanks.